Thanks, Rich.
Thank you.
Let's head to Capitol Hill and Congressman Brad Sherman, Democrat from California, for the very latest on all this. Congressman, wonderful to see you. Now, you're not only a brainiac from Harvard University, you got the JD to prove it, but you're also a CPA. You know how to deal with numbers, and unfortunately, not many of your colleagues do. But when you look at the numbers of what the CBO is talking about, and you see things like, for example, the 10 years of taxes paying for 6 years of billing on this, does any of that bother you at all?
It would bother me if you had the 6 and 10 year dichotomy, and so your evaluation of the first 10 years might give you a distorted picture. If anything, though, you look at the CBO numbers for the second 10 years, and the saving hits $1.2 trillion. So what we don't have is a circumstance where you look at one truncated picture and you get one view, and then you look at the bigger picture and you get another view. In fact, if you look at the longer term picture, you're talking $1.2 trillion in savings. Now, I want to take a look at the statutory language. And right now, I can only talk about the summaries that I've seen and the CBO scores that I've seen.
Okay, we are expecting this to come up in, I guess, the next 2 hours on the website to be able to look at it. What's the first thing you will do, and what are you mainly looking for, Representative, that you want to see?
Well, most importantly, I want to see us in a circumstance return to the people who have coverage, who like the coverage they have now, and say from now on, your Blue Cross card is no longer shrinking. My concern is, among other things, for those who have coverage now, and they think it's really good coverage, but everybody I talk to says, yes, but I know it's shrinking. My boss and my company has to compete against other companies that are thinking of dropping their coverage. Who knows, a few years from now, my company may drop coverage, or they may come up with some program that says after $500,000, I'm cut off, which is fine unless you get cancer, but otherwise it's a death panel, a private insurance. If we don't do something, we will continue to have death panels. They won't be governmental, they'll be in the private insurance companies. As to the fix-its that I want to see a fix-it for the Florida special provision, and I want to see a fix-it for the Nebraska special provision. There is no reason those states should be treated better than the state of California.
Well, you're getting right into the issue of processes. Of course, the president talked about that last night on Fox News with Bret Baier, and even he wasn't sure exactly what kind of fixes were in this thing. Isn't the bottom line here that this thing is just too large, that it tries to do too much, even including a provision about student loans?
Well, the reconciliation bill will be about 100 or so, and it's not supposed to be just a health care bill. It's supposed to be a bill that accomplishes the changes we need to stay on our budget, and if anything, to reduce the deficit further than the budget. So it's a deficit reduction bill which deals with health care and deals with the education provisions. The main bill overhauling health care is the 2,400 page bill that Senator Kennedy was still alive to vote for and was voted on late last year. I think it makes sense to say, we're being offered a used car. We in the House don't want to buy the used car unless we're also getting the fixes that we need. And I think we're going to get those fixes posted in just a few hours.
Representative, can we assume that you'll vote for this?
If the statutory language matches what I've been told, yes, but I'm going to read every word of the fix-it bill just as I've read the Senate bill, and I'll know how to vote.
And has the president
approached
approached you? I know he's been approaching individual representatives and trying to really speak to them and convince them. Have you been approached?
No, the Speaker knows what I need to see in the fix-it bill. She's assured me it'll be there. And so there's no reason for the president to call unless there's a problem with the statutory drafting. And I don't think the president is at that level of detail yet.
I got to ask, final question. You're a CPA. Do you do your own taxes?
Actually, no, I don't.
Oh, my goodness. See, even the taxes are so confusing, a CPA can't do it.
Not only that, my CPA doesn't really do the taxes. The taxes are done by the computer program. And I know the tax law, but you can't do a tax return just knowing the tax law. You have to know how to input on the computer program.
So even the people writing the tax laws don't do their own taxes. Well, Congress That's got to be number 2. After you deal with health care, please straighten out the taxes, okay?
Definitely.
I promise you, no problem.
Brad Sherman, great to see you. Thanks very much.
Thank you so much, Representative. Well, we're just getting the results.